Good morning, everyone. This is Dr. Meena from Nightingales Whitefield branch, Bangalore. So, hope everyone is doing good and everyone is following the lockdown. So, today I am here to discuss about Bell's palsy and its physiotherapy management. So, Bell's palsy is a condition where there is an inability of the eye muscles or the facial muscles to be under control. So today I'm here to discuss about Bell's palsy and its physiotherapy management. So Bell's palsy is a condition where there is inability of the facial muscles to control on one side of the face, or it can be sometimes on both sides of the face as well. And so we'll discuss today about Bell's palsy on Facebook Live, because there are few people who are under this lockdown period where they are not able to access to the physiotherapy management for Bell's palsy. So hope our Facebook Live session will help them in keeping them exercising and keep them fit and not missing their physiotherapy sessions. So I see few people joining on live here. So let's wait for a few more. And so meanwhile we'll discuss what is Bell's palsy. So Bell's palsy is a type of lower motor neuron type of facial palsy, where there is inability of the facial muscles to control on one side of the face, or sometimes it could be on both sides of the face. So these people present with different types of symptoms. So drooping of the eyelids, or it can be difficulty in chewing food on one side, or drooling of the saliva, or inability to inability to control the eye muscles, and difficulty in eating. All these symptoms. So normally Bell's palsy, the causes of Bell's palsy is unknown. It could be because of sometimes it could be because of viral infections, or it could be sometimes because of some other conditions like a tumor or a trauma to the seventh cranial nerve, which supplies the facial muscles, which is called as the facial nerve. So this could be the possible reasons, or sometimes in pregnancy, but the most possible cause could be some herpes virus infections and trauma to the facial nerve. So Bell's palsy is a condition where it can be cured with few exercises, as well as other neurological management as well. And yeah, so this Bell's palsy condition, there is no age limit for this. It can be in an 10 years old to at 70 years old. So in this condition, as it is a phase, so it is very important that most of the people come across this. Phase is the index which shows to everyone. So it is a very typical condition where your facial expressions are completely reduced over there, and which helps in, and which is not going to come down within a week or two. But the prognosis of the Bell's palsy is within 2 to 3 weeks. Even though it is not treated, it can reduce, but the main role of physiotherapy comes here to increase the muscle tone of the facial muscles, as well as to maintain and increase the muscle tone, to reduce the further contractures or tightness of your facial muscles. So this is how it is going to help. So physiotherapy plays a very key role in treating a Bell's palsy patient, because to reduce the muscle tone, as I said, sorry for the inconvenience. So this can be so this helps in physiotherapy helps in improving the muscle tone, reducing the tightness of the facial muscles as well. And the most typical feature, there is no laboratory diagnostics or any diagnostic imaging for Bell's palsy. So a person can be notified with a Bell's palsy like they will be having weakness or inability to control on one side of the face, and mouth deviation to the opposite side, not on the same side of the palsy, to the opposite side of the palsy, inability to close the eyes as well. So these are the typical features where a physician or a neurologist or a physiotherapist looks into and treats the Bell's palsy. So there are cases like with the corticosteroids like prednisone, the improvement is much better. And physiotherapy with electrical stimulations as well as with facial exercises, there is a very good prognosis to improve the Bell's palsy or the facial paralysis muscle tone, which helps in increasing the properties, everything. So today on this Facebook live session, I'll be discussing about particular exercises which helps in treating a Bell's palsy or a facial paralysis or a stroke patient where the facial muscles are compromised. So this exercises should be done under the supervision of an physiotherapist initially. After the assessment of by your physiotherapist, it helps to improve your muscle tone or properties. So please do it under the supervision of a physiotherapist for the first time. Later you can do all this exercise on this own. And the people who are already suffering with Bell's palsy, who were already taking the therapy, and right now where there is no chance for taking the therapy due to this lockdown period, so can make use of this Facebook live video for maintaining your muscle strength in your facial muscles. Okay, so now let us start with a few exercises. So there is a question for us. So hello Mr. Vera, so is this specific to stroke parents? Is it something like swallow therapy where patient, so this is something related to facial paralysis. Sometimes a stroke patient who has an facial paralysis or the weakness can see this, can go through this. Okay, but for a swallow therapy this might not help, so we will get back to you regarding your swallow therapy. Okay, thanks for your question. Yeah, so now let us start with exercises. So our first exercise, there are so many exercises for Bell's palsy. So eye exercise or a frontalis muscle exercises or lip exercise or a nose exercises. So first let's start with the basic exercises of the the eyebrows. Okay, so first let's start with this exercise. So this exercise is for your occipitofrontalis muscle, which helps in doing this movement, this movement. Okay, so I want you to copy this movement while doing this, so please look into this. So when you are doing this, so use your finger support this way, raising your eyebrows. This is your first exercise. This helps in improving your frontalis muscle tone. So this exercises should be copied on the side where it is affected. If the patient is having a left side paralysis, it should be done on the left side. You can use the support in the initial stages. There will not be much support with your face, so you need to use your finger support for doing all these exercises. Okay, and the next exercise is frowning exercise. So when you're trying to look serious at someone, so this is the exercise which helps you to achieve that movement. Okay, so this movement is also a compromise, so you need to do this movement as well. Please look at me this way. When you're trying to look at someone serious, this is the movement. 1, 2, 3, 4, 5. This is the frowning exercise, which helps in achieving this movement and helps in improving this muscle tone as well. Okay, and the next exercise is for your eye muscles. Okay, so eye is first of all, eye should be protected a lot in Bell's palsy, because the blink reflex in the eye muscles is reduced in Bell's palsy condition. So to improve the blink reflex, normally the blink reflex is very essential for any individual to keep the cornea hydrated. If there is no blink reflex, your cornea is dry and it is more susceptible for infections, and there is a lot of damage, wear and tear happening. So that's the reason always a blink reflex is important. So in Bell's palsy or a facial paralysis conditions, so there are there is compromise of the blink reflex there. So the eye closure is of a compromise there. So everyone who has this Bell's palsy should take care of the eyes, very important as a foremost precaution. So keep always eyes hydrated using ear drops given by your neurologist or a physician. So along with that, you need to do this eye exercises which helps in closing your eyes. Okay, so the eye exercise, first exercise is just trying to close both the eyes together. Try to squeeze your eyes as much as you can, this way, this way, this. Okay, hope it is clear. So you need to do this exercises at least 10 to 15 times, and at least 3 to 4 times in a day. So this is the exercise for the eyes. And one more specific exercise which helps in closure of your eyelid is the exercise for your eyeball. So this is the exercise. Use your back side of the finger to close your eyes. Okay, and try to lift your eyelids up and down, up and down, up and down, this way. Okay, so always use back side of your finger to do this. So this also helps in improving the muscle tone of your eyeball muscles, as well as your eye orbicularis oris muscle, which helps in closing your eyes. Okay, and one more specific exercise for eye is lid stretch. So this lid stretch is very important because this lid stretch helps in improving the reducing the muscle tone, or the spasticity which is developed in the eye lid. Okay, the upper eyelid mostly. So we need to stretch this. This has to be done every three times in a day. Okay, so this is the lid stretch. So please copy me. Close your upper eyelid. Try to stretch. This way. So this helps in reducing the tightness of the upper eyelid. Okay, so the next exercise is for your nostrils. So this is a very important and a little tough exercise initially in the first stages of the Bell's palsy, because this movement is it is a combination of 2 to 3 muscles. So this movement is little difficult. So let's try this movement now. So this is for flaring the nose. Okay, so you need to do this way. Try to flare up your nostrils and try to do this movement. This helps in giving a good initiation for your nostrils, nasalis muscles over here, which helps in improving this movement. So very simple technique for this is you need to imagine something. You are trying to smell a very fresh bread. So when you're trying to smell a very fresh bread like this, or trying to smell something which is very good, this way. So this is the movement which you need to initiate there, which helps in improving this movement as well. Okay, so the next exercise will be for your lip muscles. Okay, so the lip muscles are of more compromised in Bell's palsy because it is of element facial palsy. So there will be a lot of compromise over here. So you need to do a lot of lip exercises here. So the first lip exercises which I'll tell you to do is this tiny smiles. Try to make a tiny smile on the affected side first. Never do it on the unaffected side, because your unaffected side is anyways active. So you need to do this on a tiny smile on the affected side. Okay, so this is on the left side. So someone who has on the right side facial paralysis, you can do this. Okay, so this is one of the lip exercises. And the other exercise, which is very easy exercise in initial stages or in the middle stage of the Bell's palsy, is take a tissue paper and try to blow it out. Okay, this helps in improving this upper lip contraction, upper lip muscle contractions. Okay, so please do this. Do this 5 times. So this helps in easily initiating this orbicularis oris muscle contraction, so which is this movement. So when you try to whistle, or when you try to drink some water through a straw, so this is the thing. So this is the muscle which comes in action. This is the one. Okay, so this is your 6th exercise for, and this is the one of the lip exercise. And the other exercises, you need to take a spoon for this, and you need to have a spoon. It can be any of a steel spoon, or it could be a wooden stick or anything. Try to keep it in between your teeth like this. And this exercise is very important for any Bell's palsy patient or a facial paralysis patient, because this helps in initiating or improving or giving a strength to your orbicularis oris muscle, which is very important, because there will be a compromise of chewing, there will be compromise of there will be drooling of the saliva or food at times in Bell's palsy conditions. So this has to be concentrated more. Equal importance should be given to the eyes. I mean, as you give to the eyes, it should be given equal importance to this. Okay, so let's do this exercise. Try to place it in between your teeth like this, and do this. 1, 2, 3, 4, 5. So this is the exercise. And the other exercises, you can do this exercise as well for your lips. Try to touch the spoon with your lips. This is one more exercise. And the one more exercise is, try to keep it in between your lips in the front, and try to pull the spoon hard, but your lips should be tight enough to hold this. So this helps in again improving the strength of your lip muscles. This is one more exercise. And the next exercise is for your platysma muscle, which normally you see like when someone is trying to make a sad face. So this is the muscle which comes into action. So this is the this is the action. So try this, trying to make a sad face. 1, yeah. So this is the action which you need to do for increasing this muscle, this mentalis muscle, mentalis as well as the platysma muscle strength. So this is the other exercise. And the next exercise is for your again, it's for your lips as well as your cheek muscles. So this is something which you need to try. So try to gulp some air into your mouth, and try to move the air from one side to the other like this. So people who has difficulty in the initial stages of Bell's palsy, doing this can take the support of your fingers to close on the affected side, and try doing this. So this is the exercise which has to be done. And the other exercise is, try opening your jaw. Okay, This will be the other exercise. Next, in the progressive stages, you can do this exercise. Try opening the mouth symmetrically. Trying to make a smile symmetrically on both the sides. If there is a compromise on the affected side, try to take the support of the fingers. This way. And the other exercise which is very important for the lip again is saying A and U and O. Okay, so let's try with O and U first. Okay, O, 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 and U, 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 U. Okay, so by doing these exercises, your facial nerve is stimulated, your muscle tone is maintained, and your muscle properties are maintained during the healing period. So the transmission of the signals also increases slowly once you start doing all these exercises. Okay, and the next exercise is for maintaining your jawline, or to keep to reduce the deviation. Okay, so this is something which has to be done in the later stages, not in the initial stages, because it is very difficult. So this is something which we need to do in the initial stages. Okay, so the exercises, so you need to try this, the whole face. Try to pull the whole face. This exercise helps in reducing the deviation of the mouth to the opposite side, the unaffected side. So the mouth doesn't go, the mouth doesn't deviate to the unaffected side. So this exercise is very important, and the spoon exercise as well. All these exercises together helps in reducing your facial paralysis, and it helps in improving your muscle tone, everything. So the other exercise is hold some water. So the same thing what we did with the air. So try to hold the water in between your cheeks and try to move it from side to sides. This also helps. Okay, and you should try copying this AEIOUs, AEIOU. Try saying this AEIOUs more, as well as you need to say few words like sha, shu, show, move, mew, ma, more, and view. Next, pepper, paper, which all helps in getting your lip muscles closer together. So these all exercises to be copied more. Okay, so the more you do this, the more the muscle strength builds in the facial muscles, and the problem comes down. So these are the exercises which is very important for a Bell's palsy condition. So just to reiterate, reiterate the exercises. I'll just go through all the exercises once again. The first exercise is raising your eyebrows. The second exercise is trying to get your eyes, this muscle closer together, as if you are trying to look at something serious. The other one is trying to close your eyes hard. Okay, and the other exercise is trying to close this and lift your eyelid up and down. The other exercise is try closing this and try to stretch your lid as much as you can, so that your upper lid doesn't go into tightness. And the other exercise is try looking very narrow, like this way, this way. Try looking very narrow, as if you're trying to look at the sun. So this exercise also helps in closing your eyes. So this is your third exercise, and this is your fifth exercise. And the other exercises for your nasalis and the nostrils. So this exercise, and the next one is for your lip muscles. this, and the other one is trying to show your teeth. This way. The other one is trying to make a sad face, and one with the tissue, and the other one is with your spoon, and this way, and try to place it in between your front lips, front part of your lips, and try to pull the spoon. Okay, and trying to blow, and try saying O, U, and all this show, shoe, more, all these words. Okay, this helps in improving your facial muscle tone in any facial paralysis or a Bell's palsy case. So we have a question here. So what precautions can one take if the face gets paralyzed? So the first foremost precaution, as I have told earlier, it's the face which has to be it's the eyes, sorry, so it's the eyes which has to be taken care, because of the lack of blink reflex there. If there is no blink reflex, there is no hydration to your cornea, your eye gets dry, and you need to take care of that, because if your eye gets dry, there are chances for infections as well as trauma to your cornea. So try to close your eyes with a mask, or try taking tape, or try to close the eyelid on the side affected before going to sleep, and use eye drops given by your physician, and try to keep yourself hydrated. And as well as on the affected side, you need to have this taping to prevent the further to reduce the further deterioration, or to reduce the further tightness of the opposite group muscles. And as well as you need to apply some moisturizers on one side of the face to keep your circulations to keep your skin hydrated, because there will be less circulation to the one side of the face. As well as someone who has an ear infection needs to clean their ears, going to an ENT as often as possible, and try to be under their supervision, so that it helps in reducing the viral infections or any other infections, and helps in increasing the regeneration of the nerve as well, and reduces the inflammation. As well as putting in earplugs in the ears helps in reducing and helps in improving the prognosis, because of the ears, or when there is some infection, the chances of prognosis is very less. So this is how we can take the precautions. Yeah. So there is one more question. Hi Renika, so your friend got this paralysis twice. You are asking that is it possible that a person can get it multiple times? So if the precautions are not taken care after that, so there is a chance for recurrence of Bell's palsy, because there is no study saying that there is no recurrence. But there is a study saying that the recurrence of Bell's palsy is there when the person gets exposed to the same trigger. It can be a viral infection, or it can be anything. So it can be the same, it can be any other trigger, like a herpes simplex virus. So there is chances of recurrence. So for any Bell's palsy case, the prognosis is just 3 to 4 weeks, but for a complete prognosis it takes 3 to 6 months for complete recovery. So please ask your friend to keep continuing all the exercises, and to be under supervision of the neurologist or a physiotherapist for better prognosis. Yeah. So the next question. So hi Anindya, so you are asking, due to lockdown I'm not able to get any physio for electrical stimulations, so is it possible to get some help? Yeah, so I appreciate your question. So the thing is, electrical stimulations definitely helps in improving the facial nerve conduction, but there are cases who are not able to access to the facial stimulations. In those cases, all these exercises will definitely help, because electrical stimulations will add on for the therapy. But if you want a good prognosis, doing it particular exercises as per your condition, doing it in a very proper way under supervision of a physiotherapist for 5 to 10 sessions will definitely help you without stimulations. So you can please reach out us, we will definitely help you, and at the end of this Facebook live session we will try to contact you for this. Yeah. The next question is, so hello Mr. Vijay Srinivas. So this query is to do all the exercises with the Ryle tube in the nasal openings. So there is a chance for again aspirations, everything. So please try to do it under the supervision of a physiotherapist for this. So hope I'm done with all the questions. So this is the Facebook live session for Bell's palsy or a facial paralysis. Hope everyone got an insight about this, and hope this is very useful to everyone. So, and during this lockdown period, please all of you try to stay home and try to do all the exercises, and try to stay fit and stay home. Thank you all for giving this opportunity. Thank you.